Good afternoon, everybody. Yay, excellent. I see a lot of familiar names, which is wonderful. This will be great for our conversation today. Today's going to be a little bit of an active session, a little workshopy, so we're looking forward to some great discussion. Today we have with us Dr. Serkan Toy. Dr. Toy is a pretty new faculty member with us. He is assistant professor in the Department of Basic Science Education through Virginia Tech Carilion School of Medicine. And today he's going to be talking with us about taking our daily teaching and practice and turning it into research or scholarship. So unlocking the scholarly potentials throughout our teaching. So we are very excited for this very practical and meaningful session and hope that you all will engage in some active discussions. So take it away, Serkan.
All right. Thank you, Cher. I'll go ahead and share my presentation slide. Let me know if you can see it in the presentation mode or not.
Looks great.
Awesome. Thank you. Before I begin, I would like to really thank the Teach team making this possible, and working with them in preparation of this presentation was great. So thank you. And good afternoon, everybody. Thank you for coming to this session about scholarly potential, unlocking the scholarly potentials in teaching. So my objective today is to really lecture less and discuss more in the context of what is relevant to you in these different aspects of turning teaching into scholarship. And again, this is the agenda for today, brief introduction, and then we'll have a small group work in breakout rooms, and then we'll come back and report on what we discussed, and then a few minutes for closing remarks and Q&As. So to begin, really, what scholarship means in a traditional sense is that it meant discovery, creating new generalizable information. That was the traditional sense. But back in 1990, Boyer noticed more and more college professors were engaged in different aspects that were not really considered scholarship, and they were not getting credit through their teaching, application, and innovation. So he redefined scholarship to include these other aspects. And today, we are focusing mainly on turning teaching into scholarship. And then Lee Schulman came up and elaborated on what it meant to turn teaching into scholarship. So he really discussed three main things. One, making the teaching materials public, and that they are available for peer review and critique, and that others can reproduce and or build on these materials or products. So when we look at these three components, really, we know that the crux of this is publication, dissemination. So how can we turn it into publications? So before we get into that, let's take a look at what medical education scholarship has been over the years in terms of output, topics, and different characteristics. When I put medical education term in PubMed, these are the numbers I got. So we notice a pretty steady increase over the years, and I limited it by last 30 years just to make the graph more reasonable to see. One thing that I noticed is that you may have already appreciated as well, the last year we have a blip. Maybe that's just a blip, or maybe it's again COVID to blame for that. But I suspect that that number is going to remain steady this year or even go up. It'll be interesting to see how that changes this year. And these are some of the topics that people have been publishing. One review article back in 2012 looked at all the different publications and kind of put them in more common themes. in terms of what people have been publishing about medical education research. So when we look at this list, many of these issues are still quite relevant today. Issues regarding student assessment, still relevant, clinical skills training, clinical clerkships, problem-based learning. We notice professionalism in medicine. Then number 22, scholarship in education, which is what we're discussing today as well. Some of these other topics also quite relevant even today. So what really is educational research? According to American Educational Research Association, the main focus is on learning processes and the characteristics of learners, as well as some other factors that are pertinent or influence educational outcomes. Educational researchers try to describe, understand, and or explain how learning takes place while using range of rigorous methods that are in line with the educational research question that's being posed. So that's an important aspect. That's in line with the research question. So I just wanted to put this graph to show what clinical research process looks like and highlight some of the main differences between educational research and clinical research. Although randomized clinical trials are gold standard in clinical research, in educational research, we don't always have an opportunity to randomize learners. Sometimes it's because it's unethical to deny learning, some groups, or we are limited by the number of learners that we have in our context, and we can't really randomize. We don't have too many. So then what does educational process look like? I just wanted to summarize it in terms of these different steps, and those are the steps that we'll hope to discuss today in the context of your own interest. So educational research is quite practical in a sense that it starts with an actual educational gap. You may notice a performance gap and wonder why this is happening. Can we address this? And oftentimes we do even needs assessment to get the scope of this gap or problem so that we can study it further. Lit review is a very important next step that will inform our research question as well as study design. And the next step is data analysis interpretation. And in the interest of time, we'll just focus on the first three steps today. So just a few words on educational gap. This is an important first step because not all performance-related gaps are educational in nature. So one may notice that patient handoffs are not happening optimally, and he or she wants to create an education to address this gap. But if the actual problem stemming from time constraints, no matter how good education you provide to the providers, they may not be able to go through the steps to doing proper handoffs due to time constraints. So it's important to identify a gap that can be addressed through education for turning teaching into scholarship, to be able to see actual differences in the outcome. So here are some sample problems or gaps that one may notice in their practice. Second-year medical students may be struggling with interpreting ECGs, or maybe you are running interprofessional simulation sessions and notice that some teams are more efficient than others, and you may wonder why. That could be a good question to start asking as an education project. Or maybe only a few residents are reporting adverse events or near misses, and you wonder if there is a way to increase that. So these are some examples. So we did circulate a pre-workshop guide that kind of asked you to identify an educational problem or gap in your own context and talk through these different aspects of it. I wonder if we can get a volunteer to talk about their problem, just briefly, what they identified as an educational gap or problem in their environment. Can we take just a moment and seek a volunteer to share what they think?
I can share. I don't know if you can hear me.
Yes, we can hear you.
So I'm Jessica Fleming. I'm one of the chief medical residents in internal medicine. So one curriculum that we are working on implementing this year is diversity, disparities, and inclusion in medicine. And we noticed a gap in that in our curriculum. And so we're hoping to write that up this year. But that was the gap that we really noticed, was that we weren't spending enough time educating folks on cultural humility and diversity and disparities, history, etc.
Thank you for sharing that. That's great. Do we have anyone else who wants to share?
This is Bob Obenser from the VA, and
right.
we identified some projects and gaps that we see, especially in transition from inpatient to outpatient setting. The last thorough review, it looks like, from the literature review, looks like it was 2013. And even then, we're seeing things like med reconciliation, education, follow-up labs, diagnostics, appointments. And then also the transition of care is impacted by proper documentation of the inpatient stay to outpatient providers. I think in 2013, they listed that all transitions have at least a 50% chance of some induced error.
Great. Seems like you did some lit review too, and somebody already did a systematic review, maybe. Those are always very great points to start with. Thank you for sharing. This is great. This is exactly what we need in the breakout room sessions, to begin with somebody's identified education problem or gap and work through the worksheet. So continuing on, literature review. After we identify an educational gap or problem, the next step is to do a lit review. This is important because I liken this oftentimes as you walk into a room full of people discussing very passionately, and you don't know what the issues are. So the logical step is to sit down, listen quietly, and kind of understand what the issues are. Once you have a chance to understand, appreciate the issues, then now you have a chance to contribute to the ongoing discussion. So without knowing what people have done in the literature, it's hard to contribute meaningfully to that ongoing discussion. So it does help us to really get a better understanding of what the gap is surrounding our problem and what theoretical frameworks people are talking about in terms of maybe helping alleviate some of these educational gaps. It could be mastery learning if it's skills, hands-on skills. It could be rapid delivery cycle type of thing in a simulated environment for skills again, or maybe it's problem-based learning, what the theoretical frameworks people are talking about. And then relevant variables. Oftentimes you'd like to draw a straight line from our education intervention to outcome, but it's almost never the case. There are always intervening variables. And what are those relevant variables can also be found in the literature. Also, there are some confounders that kind of lurk behind, and we can't even appreciate them, can't measure them, but every study has a weakness. It's important to acknowledge them in the limitations, and those can also be found in the literature. People may be discussing those. And also, how do we measure these variables? What people use to measure them, those are also very good things and useful tidbit knowledge pieces that we can gather from literature review. And the next step is to formulate a research question, which will then inform our study design. There are a few tools that kind of help us guide through formulating a good researchable question. One of them is FINER criteria, which is a helpful mnemonic that stands for feasible, interesting, novel, ethical, and relevant. As we formulate our research question, if we can check all these different aspects, and then that that might mean we're onto something good. So feasible, for example, just one example, maybe we have only 10 residents that we're working with, and we want to do a quantitative research to see if our intervention will change the way they approach certain things. We may not have enough learners to be able to establish any kind of a reasonable difference between baseline and post-test. So that goes to the question of feasibility. If it's not interesting and people are not going to be interested to read it, it's going to be hard to publish it, and so forth. And an ethical issue that we need to obtain IRB approval for sure. And then the next tool that's helpful is PICO. And you may already be familiar with this because it's more applicable in clinical research. But it's even if it's not applicable in educational research, certain aspects of it, it's still important to consider each one of these and then determine whether applicable or not. Population is always applicable. We need to identify what the actual target learners are. Intervention, you may or may not have an intervention. Sometimes we do have observational studies, and you may not have an intervention in that case. Comparison group, though having a comparison group definitely increases the likelihood of publication, but sometimes we just don't have the opportunity to have comparison groups. Maybe we have the same learners, you measure them baseline and post-test, and maybe even a follow-up after 4-6 weeks or so. Outcome is always relevant, and time is especially relevant if you are interested in knowledge and skill retention, for example. Then you can identify different time points to do assessment. So study design, this deserves a session or two of its own, but just briefly we'll say there's quantitative, qualitative, and mixed methods approaches, and each come with different flavors. And we determine which one to use based on the research question that we have. Just a few words on educational measurement. Oftentimes in educational research, we deal with subjective and qualitative constructs. We try to quantify them, and it's not always easy. And there may be several different biases that enter into the equations as we do that. So as educational researchers, it behooves us to identify and use published measurement instruments so we can withstand peer review process. Otherwise, if you're just writing questionnaires ourselves or multiple choice questions and things like that, it would be hard to defend the validity and reliability of those tools. So it's important to, again, look to the literature and see if others use measurement instruments that could be helpful for our own project. And the next thing is really interesting. As we notice, when we look at some of the projects, there is usually a misalignment between outcome and assessment. So maybe this is the outcome. We want the learners to be able to ride a very friendly horse, but assessment looks like this. What does it tell us if a learner fails this assessment in terms of whether or not they can actually achieve that learning outcome? It doesn't help. Or oftentimes what we really have in medical education context is this is the outcome. We want the learners to be able to manage difficult cases, but then we go ahead and give them a self-report questionnaire to kind of gauge their confidence, or just give them multiple choice exams. Now, those data may not be very helpful appreciating what they actually can do. So it's important to align our outcomes with the assessment. That will also increase our chances to disseminate our work. And the next is really to move beyond self-report data. And this is Kirkpatrick's 4-step training assessment framework. That's very helpful as we plan our educational research projects to think through these different steps. The bottom is really what I call learner happiness index, where they let us know whether they found the teaching helpful, engaging, and relevant. Now that's helpful, but it's not enough data and credibility to really publish it, disseminate it. We need to strive towards level 2 and level 3, which tells us to what extent learners actually acquire the intended knowledge, skills, and attitudes, as well as what they can demonstrate on the job. Now, the 4th level is really great, but we may not always have the chance to be able to get at that level, which is not always required for publication either. So that one indicates the actual changes that happen in the targeted patient outcomes as a result of training. So this Kirkpatrick 4-step assessment framework is very helpful as you think through your own educational research project. So now that was my lecture. I think I already talked too much. And now we're going to do a small group activity. Teach team have been great at creating breakout room sessions. Now they're going to place you in different breakout rooms so that you can have a hands-on experience through this. So we will have 2 documents which are going to be posted in chat. One is a worksheet that will guide your process, and the second document is a PDF that you may find it a useful resource as you work through the process. So to make the best use of the time during the small group activity, it would be best to quickly identify one person with an identified educational gap or problem and start working through that example using the worksheet. And also, it would be helpful to have one person guiding the activity by asking those guiding questions in the worksheet and taking notes so that when we come back to the whole group, they can report back what the process was and what the thought and what you have come up with. So that is the goal, and I will try to float around between different rooms, and we will also have the teach team be available in each breakout room to help facilitate the discussion.
Yes, and if you will just take 1 minute now to download the 2, if you click on your little chat bubble, over in the chat section, Heather posted 2, they're a Word document and PDF, and you can download those to your computer right now so you have them for reference. And then we're going to be popping in and out of rooms too to make sure that you have all that you need, and that if you had any questions, just feel free to ask. But if somebody will have those, and then we've got a leader, and then you can quickly facilitate whose question you're going to use for the discussion. See you on the other side.
Okay, here we go.
Welcome back, everybody.
Yeah, I hope it was a helpful discussion. I was only in one room, and before I realized time was almost up. So that went by quick. And Sherry was not joking when she called this a workshopy. So workshops need to be longer. So, but hopefully that was helpful, discussing through some of the important steps in terms of how to take an identified educational gap and turn it into a researchable question, and then how to think through some of the different steps, turning it into a scholarly product. So as we all come back now, can we ask at least one group to volunteer and report back what they discussed, what the process was?
I will. I was in group 3, so we'll go through it. Phyllis Whitehead. We had a strong group. So did you want me to just go through the questions and answer those? Is that what you were thinking? That would be helpful?
Yeah, the gist of what you discussed and
Okay.
what the process looked like. And yeah, kind of these are the guiding questions as you report back.
Well, we started talking about what topic would be of importance and identifying an educational gaps. So we talked about delivering, teaching medical students, residents, and attendings on some level how to deliver serious news and using like Vital Talk and discussion, which is a training. And then we talked about the gaps in the literature courses, that there really isn't an accepted structural, consistent process of being able to teach learners how to do this. And much of what we learn is by experience, good, bad, or indifferent, right? And sometimes we learn by what not to do. And then some of the things is that how do you measure success with this training? And so the outcomes is challenging. The perception of the actual learner, do you feel more confident? Are you more willing? More comfortable in that sense? But also then we talked a little bit, which I thought was really great from the literature. And it was offered through complaints. We could measure complaint support communication, those who maybe had received a training or had not. When they're, when folks are complaining about bad outcomes. So we were in that process of going through not only extending the number of complaints by patients or surrogates or families, but even by nursing staff and other ancillary folks. So it was the outcome that we were talking quite a bit. Since we already have Vital Talk as a training, we have it as an evidence base. So guys, did I miss anything else that was in group 3?
Spot on.
It was a good conversation.
Yeah, I mean, communication skills always important and challenging topic. And as you figured out, it's not easy to measure actual outcomes. In that regard, you may have to be a little creative and as how to identify differences in before and after, that sort of thing. I think we have time for another group if there's a group who's willing to share what they discussed.
I can share mine since I had brought mine up earlier. Mine was the implementation of a diversity, disparities, and inclusion in medicine curriculum for internal medicine residents. It's a gap that we've noticed not only in our curriculum, but in curriculums throughout the country. The University of Texas has been one of the programs that I've noticed that has published on the topic and how they implemented it. And then we created our own curriculum, and I wrote up a different monthly plan essentially for each month of our residency year that would focus on a different curriculum for it and a different way that it was delivered. And based on the documents that you all had us follow, we didn't get to every part of this rubric, but of course the topic is incredibly important to study because as physicians, we pride ourselves on being able to care for a diverse array of populations and not only be able to care for them, but to support them in their cultural differences and come from a place of awareness of our own implicit and explicit biases and how those affect our care since everyone has them. And so helping residents improve not only their awareness of their own implicit and explicit biases, but also how the systemic structure of our society has affected our patient populations in ways beyond which, most individuals can understand, and that will make us better providers in the future. So helping fill in that gap through residency is critically important and is majorly lacking throughout most curriculums and most residencies. The problem with, quantifying how everyone has experienced the array of the curriculum that we've now offered is the lack of a validated measurement tool. We talked a little bit about the Harvard implicit and explicit biases surveys that were previously validated, but there's been controversy around them and questions whether or not they actually reinforce bias. And there has been overall a lack of ways to quantify how people have changed their practice as a result of a curriculum like this. So some ideas that we thought of to be able to measure over time and or retrospectively look back were to see if, the implementation of this curriculum changed the way that people were seeking volunteer work, or if it affected the way that they chose research projects. Someone also suggested looking into conflict resolution within residency programs or amongst care providers of different cultural backgrounds, not only just patient and physician relationships, but physician-physician relationships, or physician and other healthcare staff relationships. And also looking at not only patient satisfaction data, but also patient outcomes data in the little enclaves where these kinds of curriculums have been implemented, and see if it affected outcomes or patient satisfaction.
Oh yeah, those are great thoughts, and definitely an important topic. But again, it's a challenging one to be able to measure certain aspects of it, as you also noted. So I think GME is somewhat recent in these efforts, but undergraduate medical education, I think, have been trying to implement such curriculum. Have you seen things in terms of undergraduate medical education publications, and see what people used in terms of measurement instruments, or different kinds of educational interventions, whether they were effective or not?
So this seminar is extremely helpful for going back and looking at the validated tools that other programs have used. And so far, other than the Harvard implicit and explicit bias tests, I think that the majority, like the University of Texas publications that I've seen, have come up with their own way to measure how much it has affected practice. But yeah, I have to go back and dig through again and see if there's anything else that's been validated, because last time I checked, which was about 2 months ago, there was not.
Yeah. Yeah. And in terms of doing a needs assessment, it sounds like you'll look through the curriculum and identify the gap in the curriculum. Have you done some sort of a needs assessment, asking the trainees themselves? And when you do a needs assessment, by the way, the burden of proof is much lower than when you do an actual intervention assessment of intervention, whether it is efficacious or not, because the needs assessment is helpful in identifying the gap and the scope of it, so that you can prioritize and do the intervention targeted in those aspects.
Oh, that's a great question. And even just the terminology in the needs assessment as, one of the preliminary ways to study this is new to me, since this is all kind of a novel approach for all of us in our program. So we did actually do needs assessments without realizing, what we were doing. We were just seeing where people are starting. And so a lot of it was surveys with, with 0 to 5, 0 being not confident at all, and 5 being very confident, for example, and had the residents scale a lot their understanding of various DDIM topics, or diversity, disparities, and inclusion in medicine topics, based on those scales. So we started with those.
Sounds great. I think we have time if anybody else wants to just summarize what they discussed. Otherwise, we could just continue with the closing remarks. And if there are any Q&A, we can address those. I'll pause for a second and see if anybody wants to chime in.
And Jessica and others, I really want to add additional encouragement behind what Serkan has said, and what Arthur Ohlendorf has said in the chat. Just focusing on, there is so much out there. If you're just focused on GME in the literature, there's a whole world of other things out there within other aspects of medicine, even within the nursing world. Nursing is way ahead of us in lots of areas of education and education research. So looking into different areas beyond GME could be very helpful in finding some measurement tools.
Definitely. That's a great thought, Sherry. Thanks.
Our group, this is Sherry Hartman. I kind of steered our group down the path of looking at a research question around the benefit of interprofessional education. And I got helpful input on making it more realistic. So, which is always a challenge. How do you actually get to study your question? But the focus of this interprofessional training would be to educate both the rehabilitation field, physical rehabilitation, as well as, let's say, addiction treatment field was what we narrowed it down to. Because of an identified gap in providing adequate services for persons with addiction in the field of rehabilitation, persons being excluded from rehab programs by virtue of having a history of addiction, for example, and then vice versa, addiction treatment programs, not using best practices to make their services, their addiction treatment services, accessible to persons with a physical disability. So this is a real problem that's been identified. The possible solution, I always love to lift up education as a possible solution for that kind of problem. And so the idea is that if there were interprofessional education in these fields, that we would be doing better in providing services in both domains. Then you get to the issue of measurement and, where you're going. I think after hearing this discussion, we're likely also to be measuring needs assessment, and not jumping right to outcome measures. But there was somebody in our group who pointed out, of course, your ultimate outcome measures would be increased accessibility, in those two fields. Those who participated in the education, did you in fact have increased inclusion of the populations that we're talking about?
Yeah, no, that's great too. Thank you for sharing. And now we can continue with thank you everybody, by the way, for your active participation and discussion. It seems like people were talking about very interesting gaps or problems, and I hope this will help you think through the steps, how to turn it into scholarly activity. And in closing, I just wanted to reemphasize the importance of real educational need. Make sure that what you're starting with is an educational in nature, and that's a real need. So again, needs assessment, as we tossed around that term a few times already, is usually very important to be able to identify the scope and understand the scope of the need, as well as how to prioritize it. And research question, as we learned about several tools that can help us formulate our research question, and that's a sound and researchable question. Then we know that it will drive the rest of the methods so that we have pretty sound study design, because we have a good research question to begin with. And oftentimes when we look at the rejected papers, people do 45 minutes of lecture and expect the worlds of outcome from it. And so the intervention needs to be appropriate in duration and scope. Make sure that whatever you're trying to change, that you provide a strong intervention to actually make a change in that. And it's authentic within a realistic setting that the participants are actually going to practice this in their work environments. It's not some irrelevant thing that is kind of removed from the real life situation, and it's learner focused. And also the last, but one of the most important points is to moving beyond self-report, as we discussed earlier. It's important to look through the literature and identify published measurement instruments. If you can't find anything, then it's upon us to create one, but make sure that we do the work to go through that psychometric assessment of the measure, so that the data that we gather is reasonable, and it's that the conclusions that we draw from those are relevant and meaningful for practice. So, and again, medical education scholarship can come in several different formats. It doesn't all have to be assessing the efficacy of an educational intervention. You could also publish a novel curriculum. If you have a really great idea that addresses a significant, relevant, interesting topic, then you can publish the description of that novel approach. But the challenge is to find the right journal for that. Not all journals have that option, but if you find the right journal, you can publish your novel curriculum with accompanying resources and everything else, so that others may have similar situation in their own context. They may be able to take and replicate and use it in their own context. And just by definition of scholarship, making it public is one of the important steps of turning teaching into scholarship. You can provide a perspective on relevant and timely issue. I've seen many perspective pieces in journals these days. And if it's really relevant and timely, you can write about that and publish as a perspective. Or literature review is very important. If the topic is such that there's a lot of literature on that, you could do a systematic review. Or if it's an up and coming kind of a new field, then you can do a scoping review to kind of scope the literature, the depth and breadth of the literature around that topic to inform, to synthesize what has been done, so that it can inform our future work in practice as well as in research. And again, we discussed several times, assessment is a very important aspect of doing educational research, because the constructs we deal with not easily addressed using objective means. So we end up creating sometimes a very novel way to assess certain constructs. So one can write about that and publish on that as well. So anyways, I just wanted to mention that there are many different ways you can publish your teaching beyond just assessing the efficacy of an intervention. So this concludes my presentation, and I will be happy to take any questions at this point.
Thank you so much, Dr. Toy. This has been wonderful. And I just want to encourage folks, anytime I talk about education scholarship, I always want to emphasize that education scholarship is a team sport. So while it could seem overwhelming at first, we have expertise throughout our organization in all different areas of education scholarship. I know the lit reviews aren't my favorite. I do like reading the literature, but it is a little bit of a process. We've got some fabulous librarians to help with that. We also have lots of folks who are practicing lit reviews and are really skilled at doing so. There are folks who are skilled at assessment in all different areas. So don't feel like you have to take this on yourself if you are interested in doing some, getting your feet wet and doing some education scholarship. So does anybody else have any other questions for Dr. Toy?
And if you come up with any questions after this, I'm happy to, take your questions through email as well. I'll be available if you want to email me and ask any questions, or if you want to have a brief meeting to think through your question, just brainstorm with me. I'll be happy to do that as well.
And let us know if you're looking for others to work with. We sometimes have a broader perspective on who's doing what throughout the organization, or who's super skilled. They're looking for a new project. So let us know through Teach. We are happy to guide. All right. Excellent session. I hope thank you all for having such engagement throughout the workshop. And I hope you all have a wonderful rest of the day.